I think precision preventative medicine is undergoing a bit of a revolution right now. Traditional medicine approaches are really thinking about what's the best health that we can give you on average for a whole population. I don't necessarily want average health. I want the best health that's optimized for me as an individual. What we do here is a really comprehensive assessment across a lot of different domains, including blood work, continuous glucose monitoring, DEXA scanning, VO2 max. By taking that whole picture of the patient, we can really counsel them on what their current state health looks like, what their risk for future disease might be, and then we integrate nutritionists and we integrate personal trainers so that we are all on the same page about what that individual person's biology is and what it is that they need to achieve their goals. There's no one specific test that will tell us everything, but there are a few that I think stand out in my mind that I immediately gravitate towards when I'm looking at someone's results. The first is ApoB levels. The apolipoprotein is actually the causative agent in inflammation and damage to arteries and blood vessels in the heart, in the brain, and other places in the body. By looking at that value specifically, what we can really tell is how much that person is at risk of developing heart disease, stroke, and other chronic diseases. The other one that I look at frequently is lipoprotein A. Lp(a) is also a sort of a special case of lipids where it's extremely inflammatory to the body and can cause really severe disease. About 10 to 20% of the population may be walking around with highly elevated lipoprotein A levels and not be aware of it because it's not commonly tested for. The other test that I frequently look directly at is the visceral adipose tissue on a DEXA scan. So the VAT, it's the amount of visceral fat mass inside the internal organs, inside muscles. This is really inflammatory fat tissue that can cause a lot of problems, including insulin resistance and metabolic syndrome. It's associated with cardiovascular disease, cancer. And by looking at that number specifically, we can tell for a person's given age, how much fat mass do they have. My goal is to minimize that as much as possible. And when I see it elevated, it really nudges me to be thinking about using things like a continuous glucose monitor to restrict calories and also to prescribe an exercise regimen that I know will ultimately burn down some of that visceral adipose tissue. When people are really concerned about their muscle mass, I look on a DEXA scan for this appendicular lean mass index. And when we look at that, we can sort of stratify people into percentiles for their age, right? Are they under-muscled or do they have an adequate amount of muscle? We know that healthy skeletal muscle tissue is really protective for a lot of things, including against metabolic syndrome. So I look at that, and then if someone's really having trouble getting their percentiles up, we'll start to look at other markers. Is there a significant amount of inflammation going on in their body? Are there hormone levels out of the normal ranges? In particular, we look at testosterone, both total and free testosterone levels, and really trying to optimize those through non-pharmacologic interventions, as well as recognizing that there will be a subset of individuals who actually probably do have real symptoms of low testosterone and will need supplemental replacement therapy. We've curated a very high yield set of biomarkers, combining that with functional testing like a VO2 max, a DEXA scan, continuous glucose monitoring. And by putting all of this data together, I think what we have built out are packages that are really aimed at combining a comprehensive approach to your current state health and predicting later term disease, both cardiovascular, metabolic, cancer, and other forms. What we can do by taking all of that data is get a really detailed initial snapshot. We can then use that initial snapshot to set goals, right? And identify how we're going to achieve those goals. And then we can retest using these same biomarkers to track progress, to reset our goals, to set new targets. No matter how good we get, there's always room for optimization and improvement. I firmly believe in continuous improvement over years is how we're going to achieve really good health span. We're obviously testing a lot of different biomarkers when we do these comprehensive assessments, but one big bucket that we pay particular attention to is lipid assessments, because that predicts cardiovascular disease. And so in those, we're looking at traditional lipid profiles, but we're also looking at things like ApoB levels, lipoprotein A levels, and combining them with inflammatory markers like homocysteine and C-reactive protein. Taken together, I think it gives us a really good snapshot of who's at risk of cardiovascular disease, particularly when taking into consideration their personal or family history. The other area that is very interesting is looking at metabolic health. People who may be seemingly very healthy may have had like a hemoglobin A1C test done by their doctor that was considered to be normal. Well, I think we do a deeper dive there, right? And we can really integrate things like fasting insulin levels, continuous glucose monitors, DEXA scanning, to get a better snapshot of who's at risk of early insulin resistance before they actually develop metabolic syndrome, prediabetes, and diabetes. I think a lot of people have done some amount of blood work, or they've done some testing, and they've gotten results that really validate that they're quite healthy. And that's fantastic. That's what we hope for most patients. We offer a broader range of lab tests that really try and identify risk of disease early on. I think a perfect example of that is identifying risk of insulin resistance or metabolic syndrome. You may be totally healthy right now, but your risk of developing those diseases down the road can be identified. We can really start to bend the curve, nudge people in the right direction to put them into an even lower risk category and avert the development of some of those diseases down the road. My goal is to work with patients and clients and partner with their primary care physicians. I'm not here to replace anyone's primary care doctor. But the reality is, traditional medicine doesn't have this total comprehensive view that integrates things like nutrition, exercise, and some of these more novel biomarkers. By bringing all of those things together, not only are we incredibly comprehensive, but we are also incredibly convenient. We can do this on a very short timeline, providing very detailed reports that can go back and really just complement and augment what your primary care provider is doing. What we really are striving to do is supplement people and make it easier to start those conversations with their primary doctors. If we identify any sort of concerning values or findings on individuals' blood work or other testing, we take that really seriously. We obviously want to have that conversation about what the implications are, counsel patients, really loop them back in with their primary providers. And we can also always make recommendations for what next steps should happen quickly to really mitigate any problems down the road.